sleep apnea can cause loud snoring, daytime tiredness, or more serious problems such as heart trouble or high blood pressure. Have you ever wondered how sleep and your dentist could ever cross paths? Or how the quality of your sleep could be linked to the development of your teeth and jaws? Well, the truth is that the two are very closely related. The proper development of the bones of the face results in better jaw alignment, improved head posture, and the strengthening of the muscles for swallowing and breathing. When improperly positioned, your jaw reduces the size of your airway and can result in breathing disorders such as sleep apnea. What is sleep apnea? Sleep apnea is a type of sleep-related breathing disorder characterized by abnormal breathing patterns during sleep. People with sleep apnea repeatedly have reduction or pauses in breathing for brief periods while they are asleep. These lapses cause a person to awaken periodically and reduce their sleep quality. Individuals may not fully awaken during these pauses and remain unaware that their nighttime breathing is abnormal. If it goes untreated, sleep apnea can cause loud snoring, daytime tiredness, or more serious problems such as heart trouble or high blood pressure. Why is sleep apnea a problem? Your health, well-being, and general quality of life are directly impacted by how well you sleep. You run a high risk of developing serious health issues when your sleep is of poor quality due to conditions like snoring and obstructive sleep apnea. If left untreated, sleep apnea may result in a number of health problems, including high blood pressure, stroke, heart failure, irregular heartbeat and heart attack, diabetes, depression, worsening of ADHD. Types of sleep apnea. There are two main types of sleep apnea that are categorized by the cause of breathing disruptions. One type is obstructive sleep apnea, the more common form of sleep apnea, which is a result of a blocked airway during sleep. This usually occurs when the soft tissue at the back of the throat collapses while you sleep. Anything that could narrow your airway, such as obesity, large tonsils, or changes in your hormone levels, can increase your risk for obstructive sleep apnea. The second type of disorders are central sleep apnea, results from a problem with how the brain signals the breathing muscles. The airway is not blocked. However, in this case, the brain fails to signal the muscles to breathe. This type of sleep apnea can occur with conditions such as heart failure, brain tumors, brain infections, and stroke. So, how does all of this link with your dentist? Sleep apnea treatment with a dentist. The American Dental Association ADA states that dentists play a crucial role in the diagnosis of patients who have respiratory problems related to sleep. For example, if your dentist suspects sleep apnea, they will often suggest a home sleep study so they can receive a diagnosis from a sleep physician for your condition. A dentist trained in sleep medicine can recognize symptoms and suggest a patient to complete further screenings. This information is gathered or learned from the patient's complete medical history, physical examination, diagnosis, and sleep tests. From there, the dentist can assist in determining whether an oral appliance might be a helpful therapy option. Oral devices and oral appliance therapy. Oral appliance therapy is an effective treatment option for snoring and obstructive sleep apnea OSA, which uses oral devices. These oral devices support the jaw and prevent the airway from collapsing. There are different categories of oral appliances, and each one prevents OSA in somewhat of a different way. The most popular oral appliances for treating sleep apnea are mandibular respiratory devices, which move the lower jaw slightly forward and downward to keep the airway open while we sleep. An oral appliance fits over your teeth like an orthotic retainer while you sleep and supports your jaw in a forward position to keep your airway open. A custom fit oral appliance can improve sleep, restore alertness, and revitalize your health. Other treatments could include a CO2 laser to tighten the soft tissue and promote collagen production to prevent the collapse of the soft tissue, and as a result, reduce snoring and often the airway for a better breathing. Benefits of sleep apnea treatment with a dentist. Treatment with a qualified sleep medicine dentist is better because a dentist looks at the root cause of your sleep problems. A dentist can provide easy, affordable, at-home sleep tests. A dentist can make a custom solution or an appliance that suits your needs. A dentist has less invasive methods of treatment, for example, scans, CO2 lasers, VCT units, and clear aligners that can expand the jaw for more space for the tongue. If you or any of your loved ones are suffering from sleep apnea, make sure to visit your local dentist who is trained in dental sleep medicine. We at Align Healing would love to, and we will be happy to serve you and help you to get down to the root cause of your issues.